Hello, welcome to this presentation by FERNE, the Foundation for the Education and Research in Neurological Emergencies. This educational lecture is titled The Evaluation of Emergency Department Dizziness Patients, New Concepts. My name is Edward Sloan. I am currently Medical Director of the Physician Assistant Studies Program at Dominican University. I have most recently been an attending physician at Carle Foundation Hospital, and I am Professor Emeritus in the Department of Emergency Medicine at the University of Illinois at Chicago. Support for the development of this lecture was provided by EB Medicine. I am currently President and Board Chair of FERNE. The content for this lecture comes in large part by the monograph titled The Timing and Triggers Approach to the Patient with Acute Dizziness by Jonathan Edlow. It was published in Emergency Medicine Practice by EB Medicine, December 2019. Other parts of this educational lecture and the complete lecture are available at the fern.org website or on our YouTube fern.org channel. Also available is the June 2020 podcast, which was presented to participants in 46 countries, as well as a CME option on the EB Medicine website at ebmedicine.net, as well as at the specific website address noted below. Please note the disclaimer listed below. In general, this information is intended to augment and not replace the clinical judgment that guides the management of any individual patient. Our educational objectives for this dizziness patient evaluation are as follows. We'd like to enhance competence, that is, knowledge and strategies to use our knowledge in patient care. We'd like to improve performance in practice, and we'd like to improve patient outcomes. Specifically, we'd like to understand dizziness etiologies. We'd like to know how dizzy patients present in the emergency department. We will consider a new diagnostic approach. We hope to be able to diagnose and treat these ED patients. We'd like to discuss dizziness in the setting of the COVID-19 pandemic, and we'd like to be able to record key historical questions and exam findings in the electronic medical record so as to exclude posterior stroke diagnosis, which is the most important diagnosis to consider in patients with dizziness. Our overview for this are as follows. The content literature that provided the basis for this lecture come from the monograph, The Timing and Triggers Approach to the Patients with Acute Dizziness. This was written by Jonathan Edlow, who is an emergency physician. It was published in Emergency Medicine Practice by EB Medicine, December 2019, Volume 21, Number 12. This is a picture of the monograph that appears. Note that EB Medicine has put Emergency Medicine Practice monographs out for the past 26 years, and these monographs are quite useful in providing care of patients with acute emergencies of all types. Please note that in the clinical algorithm, there are some class of evidence definitions as listed below. Obviously, Class 1 recommendations are the best based on the best evidence. Class 2, less secure, less definitive evidence, and Class 3 are the ones that have the weakest evidence and are simply recommendations to be considered. In conclusion, the ATTEST system for the evaluation of the dizzy patient includes the following. A, associated symptoms. T, timing and triggers. ES, examination signs. And T, confirmatory testing. ATTEST. When evaluating an ED patient with dizziness, please consider the following. Using the ATTEST system for evaluating ED dizzy patients, those patients with acute, severe, continuous symptoms should be considered to have acute vestibular syndrome. Patients who have intermittent symptoms or non-continuous symptoms at the time of evaluation are noted to either have triggered or spontaneous episodes of dizziness and vertigo. Topping the list of diagnoses using the ATTEST system are orthostasis, BPPV or benign paroxysmal positional vertigo, and posterior stroke. BPPV can be diagnosed with the Dix-Hallpike maneuver and can be treated with the Epley maneuver either in the emergency department or in follow-up. It is noted that you should evaluate patients with caution in the setting of the COVID-19 pandemic, as the COVID virus can cause neurological symptoms and/or can complicate those neurological symptoms because of poor PO intake and dehydration, which can cause orthostasis. Electronic medical record templates and dot phrases can help to make the exam process more systematic and easily accomplished using the ATTEST system. When evaluating dizziness patients in the emergency department, the following is recommended. Understand that the dizziness pathologies using the ATTEST system fall into 3 diagnostic strata and basically involve 6 diagnoses and 3 specific treatments for those diagnoses. Also recommended is that you study the Nystagmus findings, significance, and BPPV maneuvers, Hallpike and Epley, online and in the monograph from which this lecture was obtained. Also, create EMR templates and dot phrases to exclude posterior stroke findings in your dizzy patients in the emergency department. Explain the etiology of the dizziness, including the diagnosis and treatment, and provide appropriate referral for patients with dizziness, explaining to them symptoms which should cause them to come back to the emergency department for repeat evaluation. Lastly, utilize caution when evaluating dizziness patients in the emergency department in the setting of COVID-19, as this virus has both neurological complications and symptoms and can cause orthostasis due to decreased PO intake. If you have specific questions related to this educational content, please send an email to fern.org@gmail.com. We encourage you to go to the fern.org website for more content related to this educational program and other content related to the care of patients who present to the emergency department with acute illness and injury related to neurological emergencies. Thank you for your participation in this FERNE educational program.